So, good morning, everyone. Very good. You're still awake. I like it. Okay, yeah, I'm the British guy from California who's been brought here to make you very scared about the future. But I actually, before I start talking about Smack Health and Karl Marx, because I did go to Cambridge and I do know something about the philosophers of ancient Germany, I want to bring you back to a simpler kind of time. Yes, I want to go back to the 90s when we had so much time. We were so happy, we were so carefree, we actually could spend a whole lot of time talking about office politics and who was doing what to whom under the desk. Unfortunately, in the last 15, 16, 17 years, all that kind of fun has gone away, right? We've had a lot of big things happen, a lot of bad changes. There's been 9/11, there's been war, there's been recession, there's been the Middle East having the Arab Spring, which led to a lot of problems in terms of refugees and civil war in Syria. And of course, behind all this, there's been a big change in the world, especially when you're an American. You think that, oh, there's a rise of this whole new superpower coming from China. So a lot of challenges, right? A lot of changes. At the same time, we went into this century with technology like this, and we've still got these. Who's got their Palm Pilot up the back there? Someone, that's right. And the flip phone. And we've come out of it now. We're really much improved and very different tools. Same thing on the technology and software we're using. You may have been on eBay. You might have bought your original Gremlin life-size gizmo prop. You might have bought your Pez dispenser. You might have used Yahoo. And now on your phone, you can get anything you like. You can say anything you like. You can go anywhere you like. And you can hook up with anyone you like just from your cell phone, right? Okay. There have, though, been actually some massive, significant improvements. All these changes that probably would scare people have actually changed. If you go back and hover up and think about this, the world, this is a chart of the world of 100 people called Our World in Data. A guy called Max at Oxford University has been putting this together. We've got better on a lot of metrics. So actually, if you think about things, we've got better. But that's not what you're hearing in the news, and that's not what people are thinking about when you poll them, how direction their countries are going. So a couple of significant incidences. One from my old country, right? Decided they didn't like those Europeans, didn't like those foreigners, voted to do Brexit. And then, you know what the other one is, don't you? Come on, you know the next one. People are scared, and you end up with this kind of thing. All right. There'll be a little bit of political commentary. You may guess I'm probably not the greatest fan of Donald Trump coming from California, but nonetheless, there are significant consequences to this amount of change. The good news is you're Australian. You're the lucky country. You don't have to worry about any of this stuff, right? Okay, you've got all that mineral wealth, making you all fantastically wealthy, making your coffee incredibly expensive and complicated as a consequence, because you all have too much money. You've got this beautiful lifestyle. You can hang out in this beautiful weather. Even your damn comedians are now taking over the world. You know this guy? Is he famous here? He's actually got quite famous in the States, Jim Jeffries. And of course, you are the best in the world at sport. Well, at least at this sport, because nobody else plays it, right? Okay, and then for years and years, you've had this fantastic, stable political system with only a few prime ministers. Everyone knows what's going well, and it's been completely fantastic, hasn't it? Oh, you seem to have gone through rather a lot of prime ministers lately, and apparently if I was to do this chart again tomorrow, I'd have to add another one, but... So maybe even in Australia, you need to start thinking about some of these things. All right. What do we know? We know that uncertainty breeds distrust, right? That's where Donald Trump came from. That's where Brexit came from. That's where this political uncertainty comes from. It's not just a political thing. It's across the whole of society. Okay. So now I'm going to tell you a little bit about Health 2.0. Actually, not much. So I founded Health 2.0, co-founded it with Indu Subaya back in 2006. And we started really to look at to build a new conference and a new movement, looking at all that new technology. A lot of it you've heard already a bit about. This is a picture of Indu. Indu is eloquent, intelligent, visionary, beautiful. But unfortunately, Louise couldn't afford her speaking fee, so you got me instead. All right. But this is Indu's definition of what Health 2.0 is. It's adaptable technology. It uses technology that plays well with others. We heard already a bit from Richard about sort of do you use best of breed, do you use a single vendor. In the modern world, technology has to play well with other types of technology. We've got to be focused on the user and the user experience and improving the user experience, whether it's for a patient, a physician, a clinician, or just anybody out there in the system. We've also got to worry about data. We've got to use all that data out there to improve and drive our decision making. We have not done enough of that. When you've got information on paper, it's very hard to do it. There's a lot of ways we can think about doing that. But going on over the last sort of 10, 15 years, we've had three really huge transformations. And that's what I'm going to focus on a little bit right now. The first one, and we had kind of said a little bit about this, but there's a lot more to come here. First one is about the patient. This is the role from activist e-patients to, moreover, a consumerized care system. It's coming, it's coming, it's coming. Here is a good example. This is my friend Michael Series. He's a patient who had irritable bowel syndrome. He ended up in the UK having significant surgery. He's prepping for one. And then after his surgery, he wanted to get in touch. This is back in 2013. He wanted to get in touch with his doctors, his hospitals by Skype. The NHS wouldn't let him do that. But he did get access to the messaging of his text messaging of his doctor. And then he got his doctor onto Twitter, right? Actually, it's pretty fun. His doctor thought he was direct messaging him, but in fact, he was just doing @Michael's MJ series and telling the whole world about his medical problems. What actually was quite good here was that a bunch of other doctors started joining in and exchanging, and he actually had a sort of entire medical council going just on his own Twitter feed. Now, if you think about it, most people, and this is an American survey just done this year, most people would like, maybe they wouldn't you wouldn't want it publicly on Twitter, but most people want these kinds of tools in terms of connection. They don't like through the old world. They want to see the tools they're using elsewhere in their everyday lives used in healthcare. And I think that's a big challenge coming up. Just the end of the story of Michael, he's doing very, very well. All his surgery went great. He is the ultimate e-patient. And of course, this is him presenting on stage with me in Barcelona early this year. So what do you do if you're an aggressive e-patient liking healthcare? What do? Come on, guess. Someone must have a guess. No. All right. You do your own healthcare startup. And he's now the CEO of 11 Health in California. He's raised venture capital, and he's building a whole bunch of tools for patients just like him. All right. That's first big transformation. Second transformation, we all know about this. We're changing in our healthcare system from a 10,000-year tradition of showing up in front of the shaman, the witch doctor, the medicine man, the barber surgeon, the highly paid trained specialist, where you show up for 5 minutes, 10 minutes, you have a procedure that lasts a few hours, and then you're gone and you're not seen again for a long time. We're moving away from that model to one of continuous care. What do we know about continuous care? Well, there's been a lot of research done about this by the Commonwealth Fund in the US and others. And the answer is, I'll make you read this chart, but we do it really pretty badly, right? We don't do a good job of managing the care of chronically ill people. We need to do significantly better. We also need to figure out how we pay for it better. In the US, this has come up with this big buzzword, which is part of the whole Obamacare thing, called going from volume to value. Every country's got their version of this. How do we figure out to incent and direct clinicians and patients to figure out how do we improve the outcomes derived for a significant input rather than paying people just to do the inputs? So this is going to be continuing on. This is a big process. It's going to take many years, probably the next 30 years that Richard just talked about. Third big transformation for you is going from what we've basically been talking about so far today, enterprise-level technology. Now, we just had the the digital health, what's it called? The thing that Tim Kelsey's doing. He's going to hear talk about it in a couple of days. Just had that statement come out, and I want to read you a piece that he wrote here. Just in the report that came out on Friday. It said, we're now approaching the point at which the power of the computer can be harnessed effectively to relieve the burden on clinicians and leave them more time for patient care. Do we all agree we're nearly there? Okay, this was said by a British government minister in 1984. we're not quite there yet. Nonetheless, in the US, and catching up, the US has caught up with the rest of the world now, we ended up putting in electronic medical records. We've done a similar sort of thing in Australia. They were a bit ahead of us in countries mostly beginning with N. The Norwegians, the New Zealanders, the Netherlands were all ahead of us on the game. But we now actually have got the basic infrastructure in place. We're starting to move people off paper. But this is all enterprise technology. This is client-server stuff. There are still lots of computers being put in the basement of hospitals. And of course, that's not exactly how the rest of the world is operating. So this is the SMAC Health part. I promise you SMAC Health and Karl Marx. This is SMAC. Anyone know what this means? I'm going no nods, no recognition. Okay. SMAC, I think it's an Indian term, actually. Social, I bet it's sensors, because sensors are very important. Mobile operating systems, obviously Android, iOS. Analytics, a lot of online analytic processing, that big data we talked about. And of course, all on a cloud infrastructure. If you think about everything you're using, those of you who are tweeting away or taking notes or using Gmail or using G Suite, this is how not only consumers operate, this is actually how the rest of the world in business is now starting to operate. And yet we're still putting in that enterprise technology in healthcare. Well, I'm very proud of this next bit because I did this little bit of PowerPoint magic myself. I've invented a new term. Look at that. The S goes down nicely. Well done, me. It's called SMAC health. Because this is healthcare, we don't just want technology. We want empathy. We want kindness as well. So the K is for kindness. There's even a little website I put up called smac.health. You can go and take a look at that if you like. You've all used these tools. You know how it works in the real world because you use these tools every day, not only in consumer world, but also in business, right, with things like the Salesforce App Exchange. So it's coming to, slowly, but it's coming to the world of enterprise healthcare. This is the Allscripts sort of equivalent to their App Exchange, their App Store. Epic's got one too, Cerner's got one as well. It's very slow, but those big EMR monolith companies are starting to figure out how do they play with this new ecosystem of tools and companies that live in my world of Health 2.0. All right, that's great. But wait, there's a whole lot more, right? You've had some hints about this morning. We know that the main world of technology has got to the point where they're not doing things the way that it was done years ago on the enterprise. But there's a whole lot of new technology coming out. Okay, what we're basically doing is teaching robots to get clever and computers. Starting in the virtual world, of course, there's AI. So far, you can probably order a pizza using an AI chatbot on your smartphone. You can talk to an automated therapist on Facebook. You can ask how to vote, that kind of stuff. This stuff is going to get much, much cleverer. It's really in the early baby stages right now. But you're going to see this becoming available across the board very soon. You're also going to see some big advances in virtual reality. I don't know how many of you played with these things like the Oculus Rift or something similar like that. It's starting to get really cool. It'll be used not only for entertainment and games. Obviously, it's already massive in porn, as you might expect, because they do stuff first there. But it's going to become much more general for business use. And Apple is going to come out with some fun stuff about this in the fall, so the rumor is. Not just virtual reality, augmented reality, bringing information, in this case into surgery, bringing information, overlaying data in the virtual world onto the physical world, and building some really interesting technology. We're building some very interesting technology to go underneath this. You've heard all about the Bitcoin. I don't know how many are familiar with blockchain. There may be some sessions about it at this conference. I don't know. But what blockchain is doing is not only enabling you to store and share data, but it's also enabling smart contracts. It's basically enabling the automation of contracts and negotiations essentially between computers. It's going to change a lot of the ways we think about how we store information and how we do a lot of different transactions and take a lot of that sort of the blockage, as it were, out of that. And of course, this is going to come into the physical world, and we're going to be dominated by robots. This is a nice set of robots that hang out in Mountain View, California, but we're going to have many more of these, right? If you're driving a car or driving a truck, that's going to be changing dramatically in the next few years. Maybe it's 3 years, maybe it's 5 years, maybe it's a decade or more away, but you're going to see things like self-driving trucks, self-driving cars, really changing how we do things. But not just transportation, how we do industrialization. This is the Applied Dynamics robot. Some fun videos you can see about this on YouTube. And of course, how we move stuff around. This is a drone that Amazon's testing already in the UK. And there are other technologies coming as well. 3D printing is going to be one. This is the US Navy. It's printed a boat much faster, much cheaper than it previously made them. And we're going to have some similar things like that in healthcare as well for medical devices. Already most hearing aids are 3D printed. And then we mentioned earlier, but we're going to talk about it a little bit more in this session, of course, the rest of the conference. The whole world of genomics is going to be changing dramatically, and the whole way we're thinking about life sciences. Okay, so we have all these fun technologies emerging, lots and lots of venture capital in California and the rest of the world being spent on this stuff, the developments in a lot of interesting technologies. How's it going to show up in healthcare? Well, let me give you a few ideas, all right? Graham Grieve, somewhere, I don't know if he's in the audience, somewhere around here. Oh, Graham, there he is, the lead here on fire. Graham's somewhere here, yeah. This is going to help us move data around. I won't try to steal anyone's thunder about what FIRE does. But between FIRE, some of the early attempts to do blockchain, there are a couple of blockchain alliances already set up in the US. And obviously the advanced analytics of DeepMind from Google or Watson Health, we're really going to start using these types of tools to move that data around and find out more about the data. And that's coming, I think, relatively quickly. We're also going to start putting stuff from people's bodies into the system. This is a company called uBiome. You can test your poop. It'll tell you how you're doing. And actually, a company that debuted at Health 2.0 last year called Day 2 will actually tell you what food you should be eating based on what your microbiome is, right? We're going to be adding things from across the body. This is a company that also debuted at Health 2.0 last year Siren Care. It's going to be able to tell you if you're a diabetic, whether you have an ulcer in your foot that's getting too hot or too cold or what have you, all by sensors in the clothing. Another company that debuted Health 2.0 called Ohm Signal can not only tell you about your heartbeat and your respiration, but actually give you a full EKG from a shirt, from clothing. So a ton going on in this sort of thing. And we're getting our robots too. This is Mabu, who's a robot will help seniors and elderly people with some emotive content. Think about where they're taking their drugs and how they're feeling. And in places like Japan, where they have a surfeit of elderly people, they're experimenting with robots to really do basic functions of living, to really replace care assistants. So the way I think about this is that we've come from a world in which we're now really getting very good at informing, getting very good at connecting, and we're going to start adding to that the ability for people in everyday situations to sort of diagnose and even to some extent to treat themselves. So I'm going to show you, I have a whole hour-long presentation on this, but I'm just going to show you a couple of quick examples. So this is Patients Like Me. Many of you have seen it. It's an information system in which people can share information to their wider community. I've talked about that already. Been going for more than 10 years in the States. Really great results and really great use out of this on the informed side. On the connect side, well, wouldn't be 2017 if I didn't give you a tweet from Donald Trump. Yes, on Friday he tweeted about the VA in the US, their new video connection system. We're really seeing a massive rise in the use of all different types of tools for connection, virtual connection. Here's one I like particularly called Vida Health, which has both a combination of bringing information from the world of medications and other stuff, has coaching, has asynchronous, it has synchronous video, it has it all. It's basically a lifetime coach in your pocket. We're diagnosing. Here's a company called CloudDX. You can cough into this thing. It'll tell you what kind of problem you have with your breath. You're going to see a lot more of this kind of stuff showing up in the bathroom. And then we're going to even go to a world of treatment. Here's PhysIQ, which will actually adjust your medication based on some algorithms it's got of your heart rate for people who have post-heart discharge. And we're talking about using virtual reality, and it's already being used at Cedars-Sinai and elsewhere, virtual reality for people to manage pain. So a lot of changes in the way that we're going to be developing and thinking about how we use this technology for healthcare. All right. You were promised Karl Marx earlier. I've got to Karl Marx. Okay. Yes, I did do social and political science at Cambridge. I did read this work called, here he is sitting in Berlin. I did read this part of his work, which is the contribution to the critique of political economy. All right. What did he say in this? He said that the world is made up of forces of production. This is technology to you and me. And it ends up creating relations of production. That's the organizations, the institutions that we live in. And at some point, the forces of production change so much that the current relations of production, those institutions cannot handle it, and they have to be changed. All right. This is a picture of George Margolis, my friend here. This is his first year at medical school at the University of Sydney. You can see him at the front there with his moustache. Okay. This is the profession of healthcare. How we teach doctors and how we train them hasn't changed that much, right? Then we have these big institutions, you know them as hospitals. Haven't changed that much in how they organize and what they're doing. They're still places where people go in to take treatment and get put out of. Richard made a great point. That's the start. This is not the end, right? Okay, so what's next? How is this going to change? Let me give you, and I'll just give you some quick overview of my sense of this. I think we're going to start looking at people as individuals and how we treat them. And here's how people are, right? Most people are healthy, and a few are chronically ill, and very few are acutely ill. Those of you who are smart, what's this? This is how we spend the money, right? In fact, it's not like that. It's actually like this. We spend all the money on the acutely ill. But what we're going to start doing, I think, is saying that the one-size-fits-all healthcare system we have isn't going to work, and we're going to start taking some lessons from other industries and looking at individual pieces. So I'm just going to give you a few quick examples. For healthy people, we're going to be thinking about wellness, doing asynchronous AI-based care, doing much more telehealth, might make them travel. When you're healthy, but you might have a chronic illness, we're going to start giving you programs, preventative programs to eliminate obesity and that kind of stuff. We're going to be looking more at the data. If you're chronically ill, we're going to be building systems to manage your care. There's self-management, some of that coaching. In fact, even maybe some new types of primary care systems as a whole. And then for those of you who are acutely ill, are going to be getting acutely ill, we're going to be doing much more intensive diagnostics on that, looking at it much more closely. We're doing much more data mining on these folks as well. And then in the acute setting, again, I think we're going to be doing a lot more in terms of bringing together data, building new different types of systems and getting clinicians better professional tools. So I've got a whole bunch more I can tell you about that, but in the end, I don't think we're going to one-size-fits-all healthcare. I think we're going to be slicing and dicing this, and you're going to start seeing this coming up. There are a bunch of new kids on the block, and these are all American examples. I apologize, I don't know the Australian system well enough to tell you about this. But you're now starting to see retail clinics emerge. You're seeing virtual clinics emerge. These people are in some of the major drugstores and pharmacies in the US. You're seeing a new group of customer service-based primary care models who use a lot of intensive coaching and do things in a very different way. You're also starting to see this company called Virtua Health, this online-only clinic aimed at reversing type 2 diabetes. It's had some pretty good results so far. So a whole bunch of new technology, new techniques, and new service providers coming. But of course, there are more people, right, in the world. There are more organizations, and there are some very large organizations which really understand how to get technology and services in front of consumers, and they're thinking about it too. The folks at Apple have been pretty busy in this space, and I think they're coming in this direction pretty quickly. And of course, just last week, it was revealed that our friends at Amazon have been building a little skunk works for healthcare. If you're thinking about Amazon coming to your business, you should be pretty scared. If you're a retailer in 2006, all of these companies behind me were much bigger than Amazon, and now they're all a hell of a lot smaller in terms of their value and their market cap and their market influence. And if Amazon wants to come into healthcare, who knows? They might even come to Australia. Oh, hang on. They already are coming to Australia. All right. So we might have a much more consumer-centric healthcare system, which might involve people who understand how to sell the consumers selling healthcare. And that might be great. On the other hand, £20! £20 on my left! £30! £20 on my right! £50! £50! 90! 90! 200 pounds! 200 pounds up there! Anyone else? Going, gone! 210! Okay, so it may be that healthcare isn't entirely a consumer-only business, and we may have to think differently about how we do it. So what we're going to have to think about is how do we reorganize the professions? How do we reorganize the institutions? What are you doing? How are they going to adopt? How, if you're working in a hospital, are you going to think about these new technologies? And how are you going to change the way that you're thinking about the overall delivery of care? If we don't get it right, we have those threats. We have the idea that people are uncomfortable with change. We may start losing trust in these institutions, and who knows what may happen. It may be really bad. On the other hand, we've got a great opportunity to do so much better in changing everyone's healthcare experience. And I think that, if we work together and we think about it logically without fear, we might actually have our own equivalent in healthcare of really improving the experience, the outcome, the value for money, and the health of our communities. Thank you very much.